Good morning, thank you. Today I'm going to talk about an ARC grant that we've recently won, which builds on some previous work that me together with the rest of my team have been working on. As you know probably from the media, the recognition of the rights of people with intellectual disabilities to have a quality of life similar to the rest of the population has been gaining momentum over the last 5 to 10 years. Australia was a signatory of the United Nations Convention on the Rights of People with Disabilities, and amongst the principles that underlay that convention was the right for people to live in the community and to be citizens and to participate in the community in the same way that other community members do. Australia's had anti-discrimination legislation since 1992, and great strides have been made in terms of removing physical obstacles to participation of people in the community. Things like the new tram stops and low trams, lifts, ramps, which everybody's now familiar with. And there's new technology too that supports people with sensory and communication impairments. There's a whole range of new speech devices, and there's a much broader accessibility of pictures through iPads and easy carryable devices. In 2013, there's a major reform of disability services. Over the next 4 years, the National Disability Insurance Scheme is going to be rolled out across Australia, and the first 6 pilot sites started in July 2013. This is a major reform that's going to double the amount of funding to disability services in Australia over the next few years. And a key aim of that reform is to support the independence and the economic and social participation of people with disabilities. These policy changes signify new ways of thinking about the role of disability services as well as community attitudes. The thrust now of disability services has got to be about participation. The words are active. People with disabilities have to have a say in their own lives, to be able to exercise choice and control, to be able to learn, to be able to work, and to be able to engage in their own everyday lives. So the provision of services is really no longer about providing passive care to people, but it's about providing support to people. People with disabilities are no longer people that we need to feel sorry for or need to be looked after. They're people that are now fully recognised as citizens and should be enabled to take part in society. And the way that can happen is either through direct support to the individuals or by changing the physical and the social environment in which people with disabilities live. And you'll all be familiar, I guess, with the new images of people with disabilities that you're beginning to see, images of people being active. And this is an image from the Disability State Plan 2002 to 2013 that was published in Victoria. But actually, there's very few images of people with more severe or profound intellectual disability. This is the group of people who don't communicate with speech. The people that find it hard to take independent action and who require 24-hour support with personal care. It's much harder to imagine what things like choice and control and participation look like for this group of people. And it's actually this group of people with more severe and profound disabilities who experience the worst outcomes from disability services. One of our studies that was published in 2012 looked at residents in group homes for people with disabilities in 6 large organisations in Victoria. And what we found was this group of residents with more severe disabilities actually received less staff support. They had less contact and less assistance from staff and were less engaged to be involved in their own lives. So what we found was the people who actually need more support were getting less support. And a recent yet unpublished study shows that this group of people, over 2/3 of their time was spent doing nothing. These people lived in group homes where they were staffed 24 hours a day, so staff were there all the time, but actually we found that staff only spent 11 minutes in every hour having contact with these people. I'm going to show you a clip now which shows you what disengagement looks like for people with intellectual disabilities. And the first part of this clip are people who lived in institutions back in the 1960s and 70s. This is what doing nothing looks like. These people live in group homes in the community in modern day Australia. They're also doing nothing. And people are doing life around this guy in the kitchen. He's certainly not participating. So if you think about that, just imagine what it would be like for you if you spent 2/3 of your time doing nothing, when in fact staff were paid to support you. In fact, the government spent half of all disability expenditure supporting you in residential accommodation. So people with more severe and profound intellectual disability need support to exercise their rights. There's a very significant body of research that shows that one of the most significant factors for people with severe and profound intellectual disability is the quality of staff support that they receive. They rely on staff to create opportunities for them to be engaged in meaningful activity and to interact with other people, to experience new things and to exercise choice. People with severe and profound intellectual disabilities may not be able to participate in the whole of a task, but they can certainly participate in some of a task. They may not use words to talk, but they can certainly communicate and interact with people. This guy down the bottom is interacting with a shopkeeper and has been supported to hand over the money for his coffee. He may not be able to order it, but he can participate in that interaction. People with severe and profound intellectual disabilities do have preferences if they're given opportunities to experience different things. And they can communicate if people listen very carefully to their expressions and look and see what's happening for them. And we know from previous research from one of our colleagues in the UK that it's not the number of staff that are there, it's what staff are doing when they're there. And that good quality support is actually no more expensive than poor quality support. Person-centred active support is a way of working where staff provide sufficient support to enable a person to be engaged in meaningful activity and social relationships. There's a significant body of work that shows that this way of working by staff leads to higher quality of life for people with severe and profound disabilities. Active support is a way of staff working every day, all day. It's not about therapy and it's not about having it at specific times. It's a practice, an evidence-based practice that if staff use leads to better outcomes for this group of people. And the fundamental idea of person-centred active support is that every moment has potential. Wherever you are, whatever you're doing, a person with the right support with severe and profound disability can be involved in everyday activities. This guy may not be able to walk around the house and he may not be able to put the washing in the washing machine, but he can help to deliver the washing to people's rooms. This guy may not be able to stand up, but with the right type of bench that's low enough for him to reach and the right support, he can put things away. This person's getting the right amount of support to be involved in making sandwiches. The staff aren't taking over and doing things for him, they're supporting him to do the task. And as you can see, this person's clearly communicating their enjoyment of being engaged in an activity that's been set up for them with the right type of equipment. And this young woman is using the foot pedal with her hand to control the sewing machine. So it's about having the right amount of support and being engaged part of all everyday activities. It's not doing all of a task, it's doing part of a task. Active support as a way of working has been adopted by services in Australia for some time now, but it's not being consistently practiced all day, every day. In fact, some services have been doing it for 8 to 10 years. But our research has found among 6 large organisations in Victoria that only one organisation has consistently high levels of staff doing active support, which is much lower than we know is possible from overseas studies. So the question then is, why, if this is an evidence-based practice that we know works, and that if organisations have invested significant amount of money in training staff, why isn't it working? Why are people still spending most of their time doing nothing? So our idea then is to look at the organisational factors that will support the implementation of active support, to try and identify what factors are most important in making this happen all day, every day, in influencing the way staff do their job. We have a number of sort of propositions that we know from some of our research, and we have some early findings from a pilot study that shows that there's some relationship between frontline practice leadership and active support. We've developed a measure of frontline practice leadership to enable us to see how good the frontline leadership is. And that's things like coaching, modelling good practice, and the frontline leader bringing to the fore for staff in meetings, in supervision, and in everything that happens during the day, the importance of practice and supporting people to be engaged, rather than the importance of being in the office and doing the paperwork and ticking the boxes. We also have a sense that there's another factor that's important, which is about the way organisations translate their values into action and whether they do this consistently, whether there's a coherence through the organisation. For example, we found things like obstacles at the middle level of management in organisations. So, for example, in one organisation, the finance people thought it would be a really good idea if they issued cards to the staff so that they could go shopping at the large supermarkets, so they would get discounts, so they could buy in bulk, so they didn't have to get receipts, so they didn't have to handle money. Now, that was really convenient for the middle managers. The problem is that administrative decision meant that it took away the opportunity for people with disabilities who were living in the house to go round the corner to the milk bar, to do small amounts of shopping, to be able to be involved in some of those interactions. It meant also that people had to go to the large supermarket, and they actually aren't very friendly to people who have autism and who find spaces, large busy spaces, really hard to deal with. And when the people moved out of queue, the Department of Human Services provided buses to people, to each group home, 6-seater large buses. It gave a very strong message. We want you to go out in sixes in the community, rather than having much more individualised support to be engaged in your own life. So the question is, do senior managers understand the importance of practice, or are they just interested in the bottom line? Do they, when they come to visit houses, look for things that are clean and tidy, people sitting nice and neatly, or are they looking for people being involved in their own lives, in messy things happening, beds being left unmade until the person's able to be supported to do it for themselves? So we have a number of hypotheses about the types of organisational factors that will influence frontline practice. And they relate to practice leadership, to organisational factors, organisational values and their translation, to recruitment and to job descriptions. So over the next 5 years, we're going to be working with 9 organisations across 3 states. And we're going to try and track the changes over time in the level of active support that they provide to the people that they support. We're going to do an annual round of data collection, which will look at the quality of staff support and will look at the outcomes for the residents. But it will also collect data about organisational elements. And this will enable us to have 3 outcomes. We'll be able to provide every year an annual report to the organisations, which will provide them feedback about how they're performing, and to help them to reflect on that and to try and improve their performance. One of the important things about our study is that we're using observational methods, so we're not relying on staff support. We go and we watch and we look at every moment over a 2-hour period about what's happening. And we know that that's much more effective than relying on staff report. Staff think they're doing a good job, and our research actually shows they're not doing such a good job. So we're going to be able to provide feedback every year to organisations, and in the long run we're going to be able to identify through a large regression analysis at the end what are the most important factors that organisations need to focus on. That will enable us to identify those factors and then to realistically advocate to embed the practice of active support in funding agreements, so that the National Disability Insurance Scheme can fund organisations that are providing effective support, that aren't caring for people but are supporting people to be engaged. Thank you very much.